Here's another health podcast from Southwest Healthcare System. It's Southwest Health Talk with Melanie Cole.
Your body relies on healthy blood flow to carry oxygen to your legs, feet, and other parts of your body. When problems develop in your circulatory system, painful and sometimes serious health issues can result. One example is peripheral arterial disease, which can occur when plaque builds up in the arteries and restricts blood flow to the legs. My guest today is Dr. Yara Gorski. She's a vascular surgeon and a member of the medical staff at Southwest Healthcare System. Welcome to the show, Dr. Gorski. So when we're talking about peripheral vascular disease, what exactly is that?
Good morning. Thank you for having me. Yes, I'll be happy to speak about peripheral artery disease and build up in the arteries, blockage in the arteries. Is usually caused by a variety of reasons. Most importantly is hereditary. A lot of patients carry a genetic predisposition for atherosclerosis, hardening of the arteries. A second important cause is smoking. Smoking is one of the major reasons why patients develop plaque in their arteries. Smoking can make the blood thicker, increase blood clots, and also increase the deposit of plaque in the arteries. After that, there are the risk factors like diabetes, high blood pressure, high cholesterol. Those are the main causes for buildup of plaque in the arteries.
So how would anybody even know? I mean, if you go in for your annual physical and maybe you have your cholesterol levels checked, that doesn't really check for that atherosclerosis, Dr. Gorski. So how would somebody know?
Well, it's very important, as you said, that you have your annual checks, that you follow up, that you take care of your health issues with your primary care physician. But a lot of times it takes to be asked the right questions to understand if you have atherosclerosis or not. And a simple test in the office where the primary care doctor checked for your pulses, ask for symptoms of peripheral vascular disease, like, for example, are you having pain when you walk? Are you getting your legs are feeling tired? Or are you having wounds in your legs that are not healing? Those are symptoms that might trigger your primary care physician to consider ordering a further testing to identify if you have peripheral vascular disease or not in case you have decreased pulses. And a lot of times it's just a blood pressure check on your legs and a sonogram.
Okay, so who would they go to see to get those kinds of tests?
They will be sent to a vascular surgeon who is a specialist who can evaluate the circulatory system and identify if they do have peripheral vascular disease or not, and offer them, treatments.
So we hear about, for heart disease in general, Dr. Gorski, how great exercise is to help with that. But in peripheral vascular situations, exercise could be a limiting factor because it could hurt claudication in their legs. So what do you tell patients that say, well, I really want to exercise or ride a bike or go on the treadmill and help myself, but it hurts?
That's a great question. A lot of patients with peripheral vascular disease decrease, they exercise, they have this kind of limitation, and they don't know that there's treatment for that. So essentially, the same causes for peripheral vascular disease will cause blockages in other arteries. So patients that have peripheral vascular disease, they are diagnosed with blockage in their leg arteries. They actually are at risk for having blockages in their coronaries and also in their carotid arteries. So technically, they are at risk for having heart attacks and strokes. So it's very important, above all, to be diagnosed, to understand the disease process, to understand the risk factors, and find a specialist that can offer you treatments. And how do we treat peripheral vascular disease? Peripheral vascular disease, most of the time, is just treated medically. And by that means, control all your risk factors, as we just discussed. Quit smoking. Take medication. There are drugs that are specifically designed to improve the blood circulation in the legs. And a vascular surgeon, a vascular specialist, can discuss the use of those drugs with you. A lot of times patients will be also prescribed a blood thinner that can be just a plain 81 milligrams aspirin that taking daily can improve the circulation to your legs. So after that, your vascular surgeon will discuss with the patient with you, how can we actually do exercise? What kind of exercises can be monitored for patients with peripheral vascular disease and get into a program? So they will build up this exercises with the peripheral vascular disease and will develop more blood flow to their legs.
Dr. Gorski, what about the risk for non-healing wounds? If someone has poor circulation in their legs, are they then at risk for wounds that do not heal or wounds that they do not recognize are there?
That's another excellent question. So we do see a lot of patients that come to our office, vascular surgeon. They were referred because their primary care physician diagnosed them with PAD. They say, look, you have decreased pulses or you don't have any pulses. You start to have pain when you're walking, and that's called claudication. That's a lot of times is how the patients present with peripheral vascular disease. And we see them in the office and we discuss, options, treatments. And one of the key issues is you must be very careful with your feet and legs as far as, any kind of trauma or exposure to wounds. So that come two key questions. Do you have any non-healing wound? Do you have any ulcers on your feet? And what are you doing to take care of it? So there are different specialists who will work very closely with those patients. Some of them are diabetic. Some of them have also neuropathy. I mean, they have poor, other than the peripheral artery disease, they don't have a lot of sensation on their feet. So they can actually develop wounds or ulcers because they just don't feel their foot. They have a poor, fitting shoe, and they get these ulcers without even feeling for them. So it's very important when we talk to them that they take care of their feet and they take care of their wound. And a lot of times, as I said, we work in conjunction with different specialists. We recommend these patients to see a podiatrist, and if they do have wounds, we work in close, relation with a wound care specialist.
So in just the last few minutes, Dr. Gorski, what would you like people with peripheral vascular disease who or maybe are at risk for this to know and give us some good information about preventing it in the first place?
Yes, that's great. I think what we need to make people aware of is peripheral vascular disease is very prevalent. As you just brought it up in the beginning, I think the number is close to 18 million people in the U.S. today have peripheral artery disease. But a very small percentage of those patients are actually offered treatment. And treatment starts just preventing and working with the risk factors, as simple as quit smoking, taking an aspirin a day, and taking care of your diabetes, high blood pressure, and high cholesterol. Then once you were diagnosed with a PAD, you must see a specialist. You must see a vascular surgeon who can discuss with you what are your options to treat those that diagnosis. And that can be, as I said, starts medically. It can be with drugs. It can be with exercises. But in advanced cases, a vascular surgeon can actually offer treatment before you develop significant tissue loss, before you are at risk for amputation. And that treatment can be a balloon angioplasty, can be a stent placement, can sometimes even be surgery. But a lot of these patients with peripheral vascular disease, they are at risk for progression of the peripheral artery disease and for limb loss, for amputation. So it's very important that as soon as they are diagnosed, that they see a specialist, that they see a vascular surgeon who can discuss with them management, and they can monitor them over the years. And if they do develop wound, they will need to see a wound care specialist early in the stages of this wound so it will not progress to tissue loss that's non-reversible.
And why should they come to Southwest Healthcare System for their care? Tell us about your team.
We have a great team at Southwest, and I'm very proud to say that because I've been at Southwest for almost 20 years. And we have been pioneers in a lot of procedures in the Valley. And one of the things that we do that makes us, a great resource to our community is the teamwork. We do have a diagnostic department where we can diagnose PAD from its very early stages. We have an excellent laboratory where we perform ultrasonography and measuring of pressures on the legs. We have the state-of-the-art CT scan and MRI. We have an interventional cath lab where we perform, again, state-of-the-art interventions. We do angiograms. We perform angioplasties with balloons. We use atherectomy devices that we can actually debulk plaque. We can do what a lot of people use in lay terms, like roto-rooter of arteries. We have a variety of stents available in the market, and this can all be done as an outpatient. And Southwest has a great team. We have a great success with those procedures. We also have a wound care center associated to Southwest where we work very closely. I do work with Dr. Khatib for a few years now, and he's an excellent wound care specialist. Dr. Khatib is a surgeon who has been dedicated his last years just for wound care. We have a great wound care center. We offer hyperbaric therapy, and in a lot of patients, that's critical to prevent them from having an amputation and limb loss. So close relation, close work with the wound care center, wound care specialist, great tools for diagnostic and for minimally invasive treatment right there in their, for our community in their backyard. I'm very fortunate to be able to practice there.
Thank you so much, Dr. Gorski, for being with us. It's really great information. You're listening to Southwest Health Talk with Southwest Healthcare System, building relationships that touch the heart. For more information, please visit swhealthcaresystem.com. That's swhealthcaresystem.com. Physicians are independent practitioners who are not employees or agents of Southwest Healthcare System. The hospital shall not be liable for actions or treatments provided by physicians. This is Melanie Cole. Thanks so much for listening.